So hi, I'm Dr. Todd Sinett, the founder of True Whole Care, and I have the honor and pleasure of talking with Dr. Lana Butner. And it's a pleasure to have you, and thank you for joining us.
Thank you.
So you have a really unique and wonderful background, and you have brought so many wonderful things to True Whole Care. If you can share a little bit about your training, your background, who you are, that would be great.
Thank you. So my name is Dr. Lana Butner, and I am a naturopathic doctor and a licensed acupuncturist here in New York. And so my practice is from a much more holistic standpoint, as opposed to like a conventional MD, where you look at absolutely everything the patient's coming in with. Obviously, their chief concerns, but also talking about their lifestyle, stress, sleep, exercise, diet, hydration. Because that's where I find a lot of the health complaints to come from and stem.
So your training is so unique because you're a naturopathic doctor as well as an acupuncturist. And while working with patients, are there times where you're only doing one or the other, or you do both, or it's really up to the patient? How do you work with a patient?
Yeah, great question. I usually always have on both of my thinking caps, the Eastern and the Western, and I really combine both kind of philosophies and trainings because I think that that provides the patient with the best care. There are times that I'm only doing acupuncture on a patient because that's specifically what they want. They already have somebody, they work with nutrition, or they don't feel as though they need supplements. But from a practitioner standpoint, I love to use both at the same time.
All right. And then what is personally inspiring to you?
Oh my gosh.
Tough question, I know.
I know I'm looking out at the mountains right now. So that is, but also just seeing patients get better. I think seeing, number one, how when you provide some educational tools to know what it is that could have triggered that underlying disease or symptom, I think garnering them with the knowledge and then teaching them how to go forward and to really make themselves healthy. I think that's the most inspiring thing that I do with my career.
I know you must have had thousands of success stories working with patients, but if you can share one that stands out, or just something that stands out to you, or, you know, a good success story. We always love to hear good success stories.
Yeah, I think the best one that I like to go back to is I think he's a 62-year-old male who has been on ulcerative colitis medication his entire life from his early 20s. Very corporate New York, I'm only taking medications. I eat and drink what I want, all this stuff. Well, somehow I was able to really get him to trust me, trust the process, go through where he was no longer on a steroid. He had decreased his blood pressure medication. And also he was no longer on his ulcerative colitis medication through nutrition, supplementation, and acupuncture within 3 months. All of those orals completely gone. And he's been not only a patient ever since, that was 3 years ago, but also an amazing referral source and friend.
Oh, that's great. I mean, the thing that was so exciting to have you join True Whole Care is that unique perspective. And I really believe that the right philosophy and there is the philosophy for the patient, right? The patient, in my opinion, dictates the philosophy. So I never feel like the sender should dictate the philosophy because it all works. But it's just so wonderful to have you there to bring alternative medicine component that we're really missing. So, I just can't thank you enough for that. So I'm hoping you love True Whole Care as much as we at True Whole Care loves you.
I love it. I think
right?
It's fantastic.
And what attracted you to True Whole Care, and what do you love about it, or what differentiates it, or what were you attracted to?
I think the big, so as a naturopathic doctor, especially in states that aren't licensed, it's very difficult to kind of find your people because we're always kind of working solo. And if you're working in a holistic manner to really make the person better, you should also work with other practitioners so that you can get the best results with the patient. So I think having all those backgrounds, being able to bounce ideas and patient cases off of one another, and just being able to joke around with one another in the hallways, that's been amazing. To be completely honest, is all the laughing that I get to do, and I'm not just in my own zone running to patient. It's really, really nice.
I knew that you were wonderful when I found out you went to Tulane, which is the school that my daughter's currently going to. So,
I love New Orleans. My
um,
place I'm going.
so I just really want to thank you for taking the time, and we just love having you. So thank you so very much.